Welcome to Ancestral Health Today, evolutionary insights into modern health.
Welcome to the Ancestral Health Today podcast. And today with us we have Miguel Casali. He's a medical doctor who practices in Ireland and Spain. Welcome, Dr. Casali. Really glad to have you with us.
Thank you very much, Isabel. Thanks for having me here.
Yes, absolutely. So I'd like to have the guests do their own extensive introductions. And it really helps the public, get to know where your mindset comes from and what your thought process is when we go a little bit back. So tell me a little bit about, how you decided to become a doctor even.
Okay, I am Miguel Casali. I was born in Pamplona in Spain, a small town in the north of Spain, maybe well known for the bull running. I was just living in this quiet town all my life. I have no tradition about medicine in my family at all. So when I was in the last year of my studies, I can't even tell you how was it, but I felt I had to try to be a doctor. And definitely now I really know why was that, but there were no tradition. During my studies, I really enjoyed them a lot. I started to love medicine, but until the last year, I didn't realize my real vocation was to work in the community, to be a family doctor, not to go for hospitals. So in Spain, we pass a quite interesting hard exam called MIR, M-I-R. And then when you pass this exam, you can choose to be a specialist. And it was a hard exam. I was the number 548, and there were more than 18,000 candidates. And I decided to choose family medicine when I could have chosen many specialties. Cardiology, dermatology, any of them. But I really realized I wanted to be a family doctor. And this is what I've been really preparing to, striving to be in the last 3 decades. General practitioner, family doctor in Spain. The training of family doctors is very, very good. And then it hasn't been so easy to practice medicine. So in Spain in the decades of the 1990s and the beginning of the 21st century, there was no job for the doctors. Were very difficult times, and I think also these times make me be very conscious about how really I wanted to be a family doctor.
So how is medicine in Spain maybe different from medicine in the United States? What type of situations are you seeing within your family medicine practice? What are some of the frustrations that you get?
Well, family medicine in Spain is public, 100% public universal and public for the population. This is characteristic. And also it's very characteristic, the doctors are salaried. We work for the government and we are salaried. This is very good for the population, and this is also very good for the standards of the medicine we give. On the other hand, I can tell you that when you are working more than 2 decades, 3 decades, you also feel that sometimes you can't do many things you'd like to do inside the public systems because there are some limits regarding the management, regarding sometimes it's a political management more than a clinical management or a public health management. And so, it's comfortable, you have your salary, but for example, regarding other countries, you can't choose the people you work with. So you are civil servant, you work in a civil service. And so now I'm working in Ireland, and I'll tell that later. So you realize the good things and the things that are not so good of our Spanish system. I think I can tell you, it has been hard to not to be able to work every day because there were no jobs in Spain. It's difficult to believe that for a medical doctor, but it was true, was real. And then I think to finish already, you can't create inside the public system as much as you'd like. So it's more protocols, public health, or it's very well organized, but it's not as creative as I'd like. Yeah, and I think I like to be creative in my profession.
Yeah, that's although we don't have a public health system, we have the same limitations with the insurance models that we have, which the doctors are confined to only what is approved, what's in the guidelines, what is, tiered into the insurance model. So it can be very frustrating. So how has that helped you evolve in the type of medicine that you practice?
I find there is a very interesting model of family medicine developed in Spain in the 1980s after the Alma Ata WHO meeting starting the primary health care. This is around the 1970s. So I think I joined in the practice of medicine in the early 1990s, when in Spain was just after in Spain, many people don't know, in the 1970s we changed it from a dictatorship to a democracy. It's hard to believe, but I was born in Franco's dictatorship, and so in the 1980s we were just starting to dream with everything public, everything for everybody, just about democracy, and together with the beginning of the primary care and the family medicine at the biopsychosocial medicine as primary care, and when I started to listen about biopsychosocial, this is really what I love. This is really my understanding of the medicine. This model, not only biological. And so there is a very interesting person called Amando Martinzurro, and has a very, very good book in primary care called Martinzurro. And they explain very well all the the interactions of everything, and the person, the atom, the molecule, the cell, the tissue, the organ, the body, and then the family, the community. All this, we are all interacting. So this systemic model of medicine really fascinated me, and this is the one I am yet looking for, because I really love it. And in Spain, I think there are many places where you can feel this school of medicine is powerful, and so I think I was like surfing this wave of this post Alma Ata conference, starting the biopsychosocial model, and then the practice of the family medicine in Spain in the 1990s was really my background.
So what brought you to also practice in Ireland?
So, when you get a permanent position in Spain, and you are like me in the early 50s, like as I was, you say, oh, now, well, the stimul is not so stimulant, so it's already all done. So, and you're starting to join your colleagues, and you say, oh, we are in the beginning of mid 50s, and maybe you have some dreams you haven't been able to get, and in this system you won't be able to get, and the conversations starts to be around, we are burned out, just calculating the months and years for the retirement, talking about pensions, and you say, oh, I love medicine. So, and also medicine is definitely changing so much. I think the second decade of the 21st century, you start to realize because of the technology of many things. And of course, after COVID, start to realize that many things were changing in the medical profession. And you say, oh, am I going to work all my life, all my professional life, like I've been working now, or will I be able to participate in some changes? And so I knew I need to practice my English. I need to try to go to other countries to practice medicine, and that's what I did in the 2021.
Yeah, wonderful. So I met you at Low Carb Denver in Colorado at a group meeting that we were having for people who spoke Spanish. So what brought you to Low Carb Denver?
I think here I can start to mix my professional and my personal background. I mean, because from the personal background, I also come from a background of like many people fighting with or struggling for your mental health, struggling with your weight. I was around 35 kilograms more just 5 years ago, and so I think that from the professional point of view, Ireland gave me the opportunity to start to separate the earning of money. I can earn money in Ireland, and I can also I can also invest my money in my training and in my professional development. That's very difficult in Spain. So, from the personal point of view, after many years struggling with diets and with many, I think I can tell you, physical and mental problems, I started to follow the people in low carb keto community, and I said, "Oh, I really would like to go and see what's going on in USA, in Denver, in low carb." And I was able to do that because I was already working through my company in Ireland, not as a civil servant in Spain. Would have been impossible to do that in my professional status in Spain. And I felt I needed to go to this conference, and really was the starting point for many things. And the last thing I can tell you, when I was in Denver, 13 degrees minus zero, in a hotel in the downtown, waiting for the conference, I did my strategy to communicate, because I was alone, completely alone, and I create a group in an app called, I think, BOA or something like that. And I create a group for the Spanish speakers participants in Low Carb Denver, and was for me the opportunity to meet you, for example, yes, and other person as Mariela Glant, the Argentinian, who is also working with me now in projects related with low carb. And wow, I can tell you, Low Carb Denver was like the beginning of a new understanding of my professional life.
Wonderful. So did your weight loss journey include low carb, or is that something that you learned after?
My weight loss journey started like everyone with just counting calories, exercising, being hungry all day, spending 80% of your energy in buying food, cooking, and exercising and eating 5 times a day. Well, first of all, it's a decision. When you decide I'm going to change, this is something very deep. When you realize you are not going to be the same anymore, and then there is a very relevant person, a nutritional therapist in Spain called Salvador Talon, who started to introduce me in just such a simple theory of is this orthomolecular nutrition, where you just need to eat nutrients and not toxics. So that's so simple. And but no one have told me before. And even studying as a doctor, or what I was doing even with my patients, something as simple as that, I have never done. And he started also this nutritional therapist to introduce me in the low carb, not at the keto extreme, but in the of course carbs should be reduced definitely. And but then through YouTube videos, watching American doctors, many of them I met them in local Denver, and started to watch, for example, Diet Doctor channel, Dr. Berger, all the interviews they have, starting to note the movement in UK with Dr. David Unwin, and well, I started to be fascinated and tried myself. And tried myself the low carb diets and also the fasting, and finally the keto. And I can tell you, this is for me like a new life. It's a new life because it's the first time in my life I've started to feel I was able to control what I eat, and I was able to stabilize mainly my mind. I also realized my body was quite more stable, but mainly my mind. And so I can tell you everything works in the moment, in in different moments. But finally, for people related more with what now can be understood as food addiction or difficult to control the impulse to eat, I find the low carb keto diets are very, very helpful. And for me, definitely the lifestyle I can follow all my life, I think.
So you've been exposed to medicine in Spain, you've been exposed to medicine in Ireland, and to some degree, you've been exposed to medicine in the US and, the rest of the world through talking to colleagues and watching interviews and so forth. Why do you think there's such a big disconnect between practicing medicine in so many places and nutrition? Why do you think we've gotten in the place that we've gotten where, the medical system doesn't seem to understand and know how to advise patients who are struggling with different metabolic issues, not just necessarily weight, but so why do you think that's a problem?
Well, this is a fantastic question, and you see, I can tell you the training is very important. The medical training is very important. The content, the biomedical approach we are taught in the universities is understand the symptoms, give a name to the symptoms, but diagnose, and the diagnose for the doctors we are trained to go straight to some medical, to some medicine, so to something the medical system can offer. So regarding lifestyle, is not really considered a powerful tool to work with, and for I think for many reasons, because the way we practice medicine with many patients, not much time. So if you want to really educate people, it's quite difficult and then on the other hand, I think the nutrition regarding the macronutrients, mainly the macronutrients, I think we haven't been having the right answers to the question of which macronutrients are the best to eat, and so I think we have been taught that we have to eat 5 times a day and 50% of carbohydrates. As a doctor, you realize people are getting sick with this message we are giving to the patients. But you are like you can't even think about changing that if you are inside everyday system. The reasons are related to the tradition, to the training, to the how difficult it is to change this mentality. Because it's not even taught at the universities now, and it's just starting to be understood. Many things and this is lower than all the process to get the science and then put this science in a medical school, for example. So it's a very good topic to talk deeper, really.
So you touch upon the benefits of the low carb and keto diets for mental health, and there's a whole new movement, if you will, that is named metabolic psychiatry, right? A new sort of branch of medicine. Why do you think that the keto diet is beneficial for mental health?
Well, I think my main surprise last year in low carb Denver was when I was just looking there for diabetes, obesity, and some other metabolic problems. When I saw, I think it's Burchard giving here his speaker, he's speaking, and I knew very well him in the about watching the Diet Doctor channel, and started to say, "Oh, metabolic mind. Oh, Dr. Burchard is a cardiologist and is talking about metabolic mind." And I started also to realize myself the main change. My main change was in my mind through the abstinence of carbohydrates mainly, and so I started to be fascinated about that really, and it is just 1 year ago, no more, and I really think it's really powerful, the movement around metabolic psychiatry, and I'm getting ready. I've bought now a course from Georgia Eat, and I follow Metabolic Mind channel, and I started to be involved in some projects even with my family, with the projects I'd love to be involved. But just now, being trained, I'm getting the training and observing how powerful it is. And also, it's fascinating how in my last summer I was able to. I traveled to India. I also have met the community in India, and the people already working in powerful projects in Metabolic Mind in another country like India, completely different. And so I'm just starting to think about offering services on that. Is complicated. It's not easy. You need to be trained. But from my personal experience and also understanding many medical problems, minor mental health problems I see every day in my practice, I'm sure there is a powerful relationship between what you eat, between your metabolic health, and your mind in many senses. Yes.
Yeah, Christopher Palmer wrote the book Brain Energy, who speaks about all of this. So it's a really fascinating field that we've just started to tap into. So how are you approaching your patients now with all of this knowledge and this new understanding and the training that you're getting?
Well, I continue working as a GP, as a general practitioner in Ireland. And but of course, it's every day I see patients with blood test results, asking you about what to do with the diets, what to do with the lifestyle. And of course, when you understand the low carb approach in medicine, you see like different glasses people. And of course, in my everyday practice, I can advise people about mainly the macronutrients, because of course anti-inflammatory bad quality food is definitely, everybody knows is bad, but many people is thinking that things they are eating are good because they are taught, they have been told you have to take this. For example, fruits is very common for many people, eating out of fruit because they think every kind of fruit is good, and so in my current practice, every day in the GP practice, I can advise people. For example, if a person comes with high triglycerides, I don't tell them to reduce the fat intake. I just I tell them to reduce the carbohydrates intake or the fructose intake. That is what I now understand is different. And then I'm started to get ready to offer a metabolic care clinic online and maybe in a hybrid model in virtual clinic. This is what I've seen is really the future, and I'm prepared. I'm just getting ready to participate myself with my company, with my own self-employment, or developing with other colleagues. I'd like to meet. So, but I wouldn't like to abandon the routine or general medical practice, because there is the place where people also I love general practice. So and you can give very good advice in general practice, but also offer for the ones who are looking for maybe a more relevant or more decisive change in their lifestyle, to tell them I think it's good to be able to offer the alternative for anti-inflammatory low carb keto diets, understanding how they work, who are mainly they from, who can do them. Of course, everybody can do absolutely, but and organize like clinics, train myself, train other colleagues, and offer also the virtual practices. I think the hybrid model, also being able to come face to face, but also maybe just online because it's 100% possible to be done online, and offering the tools for the patients to be able to follow this lifestyle, because I believe you definitely can revert the mechanisms involved in your disease, mainly insulin resistance and inflammation, and if you can get it sustainable for months and for years, the benefits are huge. And this is the way I love to work, but not abandoning the general practice, and also trying to integrate this new science in the general practice. I think this is a challenge. It's not easy, but this is the way I'd like to work.
Now, do you find that your patients have a difficult time implementing these changes? I know that other countries are different, but for example, in the United States, in order to see a doctor, that practices metabolic health is all private. So there's a lot of people who cannot afford it. And then even for people who can afford the doctor or, another practitioner, there's also the challenge of how many hours we work. Being able to implement these changes is rather difficult. There's a lot of barriers to entry.
Yes. So I know two countries, Spain and Ireland, in this moment better. In Spain, I can tell you, I know very well Spain, the practice in Spain, and for me it's been to be very difficult to find one colleague, medical doctor or pediatrician, or to motivate this doctor to try to work on low carb keto diets or metabolic health, because it's not at all spread this information in Spanish in the Spanish general practice. In Spain, it's more common the nutritional therapist or some coaches to offer that, but disconnected absolutely from the public system. This is not offered at all, and I'm working to try to join some colleagues and start doing some research, some projects research showing that the same results that, for example, David Irwin is getting in UK about remission of diabetes type 2, we can get the same results sure in Spain, but it's very difficult in Spain. Not general practitioner is doing that. Maybe some of them, not known. Of course, a few of them, but it's not it's not easy. And I like to offer a private practice with people, but affordable. Okay, I like to, but and then give tools to people in Spanish. And I like to have like a website, blog, LinkedIn profile, social network, at least to spread all this so good people working in the world on that, and just tell this is what they are doing. This is the science is behind that. I think it's just know that in Spanish, translated or adapted by a family doctor like me. in Ireland is the same, but the Ireland is a English speaking country, and of course everything that is done in UK, in the States, in Australia is can you easier do in Ireland, because if you show them a video or a website in the UK, is like more, oh, they're doing there. So I think for me is I practice general practice in Ireland, and I'm starting to practice telemedicine, online medicine from Ireland in Spain, and I love also to work in Ireland in metabolic health. But it's not going to be easy, because people for many years, for many decades, the people are really needing the change in lifestyle are in the 40s, 50s, 60s. And they have been for decades being told other messages. And so it's like shocking if you tell them about, reduce so much your carbohydrates, even forget about bread, forget about pizza, pasta, rice for a while. And they say, oh, I've been told other things. So, I think we need everything. We need organize the science. The science is powerful now. Organize the clinical practices on that. There are many good experience in many countries. We need to spread the news in a right way. We need also to organize good clinical settings, virtual, hybrid, face-to-face. And also we need to participate in research. And so we have loads of work ahead. Yes.
Yes, absolutely. Tell me a little bit more about what you saw in India, because I know that the increase in type 2 diabetes in India has been massive. And there's a big struggle with that. So how is that effort going? What are they doing? And what are the results there?
India is another world. It's fascinating. I don't know why. It's one of the countries I went when I was just 20, because I had an uncle missionary, Catholic missionary, and I went to stay with him. And then I went back because I was working for an NGO in leprosy in the late 90s in management. And this is a familiar country for me, and amazing. My son went 1 year to work in the Spanish embassy last year. I went last year, and it was funny because I could meet the low-carb community in India. And I'm still fascinated what I found there, absolutely fascinated. So, because it's a country without a health system. They don't have a health system. Only the public system is for half of the population who can't afford nothing. And the other half, they have to spend their own savings if they get sick. So it's completely different. In Spain, if you get sick, you will have a doctor, you will have a nurse, you can go to a hospital, and it's all included in your universal health. In India, you start spending your savings if you get sick in the 50s. So lifestyle medicine has a huge future in countries like India. And on the other hand, in Spain, it is also regulated. So you are a family doctor, you have the endocrinologist in hospital, the cardiologist in hospital, the nephrologist in hospitals, they follow the guidelines. And maybe if you prescribe or you give some guidelines, you need to discuss with them. In India, is people with very simple training courses, they are already reverting diabetes much more than many endocrinologists in the Western world, because, and of course diabetes is I think is a mix of carbohydrate intake and insulin resistance, of course in low income countries and like India, very bad quality flavors, very bad quality seed oils. So inflammation plus insulin resistance is a disaster and affecting a lot of metabolic health. If you are interested, I can tell you about maybe my next trip to India and the people I'm going to meet in Bangalore working already in Metabolic Mind.
Yeah, absolutely. Go ahead, because I think a lot of our audience would be interested in learning what's going on and perhaps, joining the efforts in that community.
Yeah, so was so fascinating, so good too, because I was in a conference with David Anwin talking to him, and I told him I'm going to go to India. He told me, oh yeah, you have this email of this person, Sasingari Iyengar. Yes, and I sent a message to him. I was so good. They met me in a hotel in Mumbai. I came in from all around India, 4 different persons involved in the low carb community, and wow, I just start to feel the strength. I think you can follow all the Indian movement. They are powerful. I think in low carb, I think the most promised community, and while the Sasingar Iyengar is based in Mumbai, he comes from the pharmaceutical industry, but has realized himself. Uh, his own history is from type 2 diabetes, remission through low carb lifestyle, and now is an excellent coach doing great things, trained by Nutrition Network, the American training in low carb. And Anup Singh is another person. Already they started more than 10 years ago with I don't remember exactly the name now. I can double check and I can send you later. They have 10 years of experience with a wonderful movement in low carb in India. And I think the many people in the world need to know what's going on in India, really. And the other person is called Poshini. Poshini is a coach in Bangalore, and I think her history is so interesting because her mother has serious mental health issues. I don't know if she's happy to if I tell that here. Just tell you that she has massively improved, just reducing inflammatory seed oils and reducing the bad quality flavors, bread and less rice and changing because they eat. And even in India, they are vegetarians. Many of them just eat dairy as an animal source. And the massive improvement of her mother changing the diet has encouraged her to create a center in Bangalore for mental health and metabolic health, where they are doing great things. I'm very happy to tell you that next month of April I will visit her again because I've started to be involved in some projects in India. I'd love to participate in projects in India. I hope I will be able to do. And maybe she has started a podcast. I think you can perfectly interview her, or because she has started her own podcast, and because she will be involved in spreading the message. And definitely, India is another world. Is so energetic, is so massive population, and where things are different. I'm just starting to be in touch with them. And but I can tell you the place where you can get faster results with less investment, maybe countries as India, where for example, I was talking to Sasingari Iyengar, told me I am offering people I know they are bipolars or depressive for many years, and I see how they maybe start to go out home when they are for some weeks in a keto diet or things like that. That of course is not. Of course, there are many other things involved around the mental health. This is not only this metabolic exclusively, but I'm sure is relevant, and I've seen there are even some people like working with Poshini. They are carnivore yogis, some carnivore yogis. So they are many yogis are vegetarians, but even there are some many carnivores in India, in a country where there is also the religious situation. If you eat some ones don't eat even eggs, the other only eggs and dairy, and so I think we have a lot to learn because they get very good results, not with strict keto diets because they are because of the religion, for example, and also, but also it's not so. I think the system is not so powerful like in other countries to control what everybody does. And so I think they are very creative, and the energy of India is different.
Yeah, that will be interesting to see, how fast that tide can turn, because like you said, there's no interference from, the massive regulatory bodies, and it's probably easier in that sense, although I'm sure there are other limitations that they face. But if
Sure.
they can have these interventions from the get-go, then we can definitely see fast results, right?
Mm-hmm. Yeah. Also, I really definitely want to be in touch with them and follow what they are doing. I love them to come to Europe. I think they have many things to show us.
Yeah, that'd be amazing. So you'll be back there in April.
Yes, I'm planning to go back to India in April, back to Bangalore, and Poshini has offered me an interview in her podcast. I've told her I love to do this interview, but face to face. They are in their studio.
Oh, wonderful! Yeah, that'll be fun, I'm sure. So, anything else that you would like to tell the audience in regards to metabolic health? Any message to the doctors listening on how they can improve the health of their patients? Anything else that you'd like to say before we go?
I think we should believe in the lifestyle. Lifestyle changes. Lifestyle is what is making many people get sick, and is the way many people can get remission of many problems. I think we should just enjoy learning that. I think we should be open to check the science around the last few years and of course all related with microbiome, but also all related with macronutrients, or related with the. I think we have the same questions, but maybe we need to be open to different answers. Just to be open. I think just to be open and consider that the people who are involved in this kind of movements or new ways of working is because we'd love to be able to have the right tools for the people to be the owners of their own health. I think this is the message I can give, to be open and be able to have different answers for the same questions.
Wonderful. Thank you so much for being with us today, Dr. Casali.
Oh, it's a real pleasure, Isabel.
Thank you.
Thanks for joining us on this episode of Ancestral Health Today. We hope you enjoyed our discussion on how evolutionary insights can inform modern health practices. Be sure to subscribe to our podcast to catch future episodes.